Alright guys, we're going to be talking about Cushing syndrome today. What is Cushing syndrome? Cushing syndrome is where the body is exposed to high levels of the hormone called cortisol for long periods of time. Cortisol is a hormone that's naturally produced by the body to help to maintain homeostasis and help to regulate the body during stressful situations. So it's like that fight or flight, I guess you would say. Causes of Cushing syndrome. Most often the cause is through a steroid-based drug such as prednisone that some patients can be taking. Which prednisone you mentioned take with, like, if they had an organ transplant, transfusion, anything such as that in that area. So if they're having high levels of, if the prednisone is causing the high levels of cortisol, that could be one cause. The second cause could be a tumor in the pituitary gland, because the pituitary gland is the master gland. It controls the other glands. Because if a tumor is there, then it could cause the body to release too much cortisol because of the stress on the area, resulting in too much cortisol in the bloodstream at high levels. Diagnosing Cushing syndrome, some common signs: you could have weight gain, rounded face, anxiety, depression, trouble sleeping, high blood pressure, sores, some open wounds all throughout the body, just from that stress on the area, just their skin breakdown. If a person presents with any of these signs, the doctor will order a complete physical exam, and he could give them the full physical exam. He'll also look at their medical history, the drug history, and types of medications they've been taking. So like I said, if they're taking some of that prednisone, like anything such as that, then he'll look at that specifically. If he thinks there's enough signs there that it could be Cushing syndrome, then he will order two types of tests. The first test is a urinary-free cortisol test. That's where they measure the amount of cortisol in the patient's urine. So if that comes back positive, then the next test they will order to confirm that it could be Cushing syndrome would be the dexamethasone suppression test. This is where the patient takes a low-dose steroid pill and waits overnight, and will take next morning they'll take the blood test, and if they still have high levels of cortisol in their bloodstream, then the doctor can go ahead and make the diagnosis that the patient has Cushing syndrome. So their diagnosis of Cushing syndrome, the two types of treatments could be: the first, if it's a tumor involvement in the pituitary gland, they will isolate the tumor, find its location. They can either surgically remove the tumor, or they can go in and use radiation to shrink the size of the tumor back down to a normal level to reduce that stress on the area and lower those cortisol levels. If the cause of high cortisol levels is the patient's medication, the doctor will look at what type of medication they're looking at. He'll also look at the dosage and how often they're taking it. So he can modify any three of those things. He could switch a different type of medication, or take them off any type of medication at all, or he could lower the dosage of that same medication, or lower the times they're taking it a day. So maybe if they're taking it twice a day, maybe just once a day or something such as that, to lower those levels back down. Also, with those types of treatments, the patient usually affected by this disorder would be ages 20 to 40 years of age. Affects usually 2 million people worldwide every year. Most often it's females between ages 20 and 40. Most often it's females, but it can affect all types of age groups, age types such as that. It's not as common as most people think, but you still see it every once in a while. Some lifespan changes that occur through this. They could have muscle weakness throughout their life, obesity, acne, skin rashes, ulcers, cognitive dysfunctions, anxiety, depression, anything such bruising, anything such as that. So basically, for the prognosis of Cushing syndrome, it depends on how long the patient has had the Cushing syndrome. So a patient that's had it for long periods of time, for maybe 2 years or more, means this could take them a lot longer. If they've had it maybe, and they find it early on, they've only had it for say a month, and the patient could go ahead, and it won't take as long to treat them, because they can go ahead and catch it real quick, get them off of medication, or modify it in any such that way, and go ahead and get them in physical therapy, and get them on some type of workout program or diet plan, nutrition, anything such as that. Go ahead and get it out, and it will usually quicker prognosis than that way. Some implications and some contraindications, precautions for physical therapy during a treatment. So implications would be like their muscle weakness, loss of endurance, balance would be a great one. Help to maintain a healthy lifestyle, so they can lower their obesity down, lower those levels, get under a good state of mind. Because when you get if you're obese or overweight or anything such as that, you're going to have some cognitive function. You're going to be depressed. You're going to have some anxiety about yourself. Be thinking about yourself more often. So you're going to be thinking, oh, well, I can't do this, that. So it's going to make you feel even worse. So by doing physical therapy, getting in a healthy weight, getting exercise, is going to increase your mood. I know everybody has a way. You know, you go work out, you feel great about yourself. You feel like, oh yeah, I'm looking great. Workout month or so, and you feel great. So I mean, I think that's the same way it could happen that way. So get not just working out doesn't really just don't only just affect your lifestyle, your body type, anything such that. It affects everything, your mind, everything. So I think it's a great working out is always great to relieve stress, anything such that. So that's why mostly the implications for this Cushing syndrome would be working out, anything such as that. So some precautions for treating this would be monitoring the patient's blood pressure throughout the treatment, looking at their blood sugar levels, asking them about it, make sure they're at a safe level to perform the exercise. So if it's too high, you can't do it, you could overexert them. And also make sure they took their medications that morning. So if they didn't take their medications, then you're more likely not going to get a lot out of them. They're going to feel like doing anything, and it could just harm them overall. So same thing for contraindications, same thing if they're too high blood pressure, if it's at an unsafe level, their blood sugar is at an unsafe level, anything such as that, it's just going to be what you need to look at. So like I said, physical therapy treatments can work on balance, endurance type exercises, strengthening exercises, anything such as that. So your normal strength exercise, be band work, a lot of free weights, some light free weights, just to increase, want to do a lot of high reps, low weights, so you increase that endurance while you're building strength also. So some good exercise could be push-ups, curls, anything like a tricep extension, some mini squats, anything such as that. I mean, just to help them get in that level. You could do some balance type exercises on the balance board, wobble board, any such things, standing one leg drill. I mean, a bunch of things you could do to go ahead and increase that overall independence and get them feeling good about themselves again. Get them under a maintaining healthy lifestyle, healthy weight, doing him decrease some of that anxiety, some of that depression. Swimming, aquatic therapy would also be a great one. You get them in the pool, it relaxes them, gets them in a good mood. Everybody loves to go swimming, so they get you in a great mood, get you swimming, get the endurance going, because swimming is one of the best endurance activities you could do. So that would be really good too. Also, some other interventions physical therapy could provide would be patient education on exercises they could do at home, different type of balance things, anything to increase their independence throughout their house, anything such as that. Also, wound care, because they're developing those sores, those ulcers all throughout their body. So they're going to have some wound care they're going to have to do. So you can educate them on doing the clinic, show them how to change the wound out, how to clean it, how to make sure it's changed properly each time, when to change it, when it needs new gauze, anything such as that. So that's one of the big interventions that physical therapy could provide. So in conclusion, Cushing syndrome is basically affects physical or cognitive functioning, causes all kinds of changes, depression, other things such as that. So basically brought on by the high cortisol levels. I know we covered that in 240 lecture. I think we talked about Cushing syndrome also. So usually just takes a team approach to go ahead and get these levels under control, get them back to a healthy position, a healthy lifestyle, all the way from doctor down to nutritionists, even family at home can help them to get back to the normal levels, a normal life. So, alright, well thank y'all for watching my video. Hope y'all like it.